Today. Let's see. Why don't you bring me a water glass, my water glass there. As I see, this one is half empty.
Oh, it's half full.
That's right, it's half full. Actually, I could have used that as the opening of my talk. Again, I'm Bob Graboyes, I do healthcare, and I'm going to be your Obamacare tour guide today. And I think of my job here as to give you a smooth and pleasurable ride on the road to perdition. So, we're going to have a good long conversation, build up all the questions you want, because I'm going to try very hard not to fill the time. I'd like to make it more of a conversation. So a couple things. First of all, the law, and by the way, I'm just getting used to calling it Obamacare. I was insistent for a long time of calling it the Patient Protection and Affordable Care Act, or PPACA, whatever. No one's calling it that anymore, and I'm just sort of getting used to it's Obamacare. It's the only thing anyone calls it, and that's fine. So it's fewer syllables. That's one advantage. It's here. It's not going away anywhere. It's here to stay. NFIB tried. There it is. There we go. NFIB tried very hard to send it on its way. Not within one vote on the Supreme Court, but unfortunately it kind of tilted this way, and it's here, and now we've got to deal with it. So I'm here to talk to you a little bit about a little prognostication of what's likely to be happening to you, but also a little therapeutics to help you get through it a little bit more smoothly. First of all, there's 7 months till the day the exchanges, health insurance exchanges, are supposed to open up in every state. At the moment, to my knowledge, there are exactly 2 states ready to go. Massachusetts, which has had an exchange since Mitt Romney started it when he was governor, and the state of Utah, which has had one for a couple of years as well. Now that leaves 48 states in the District of Columbia, which still have to set them up. Good friend of mine, well-known health economist and head of a think tank, he's predicting there will be, by the end of the year, there might be 3 states up and running. He said, he'll go out on a limb, it could be 5. But it's a real big open question, how many of these things are going to actually be open, and then what happens if they're not? We'll talk a little bit about that. But the fact is, we've got 7 months till the whole thing's got to be set up, and most states have barely begun even thinking about it. In fact, half the states have said, no thanks, we're washing our hands. Washington, you want it, you do it yourself, and there's no evidence at Washington yet, and at least that Washington is capable of pulling it off. So how do you deal with it? Well, I'll tell you a little story. A couple months ago, I went speaking out west, and I had to fly into Salt Lake City to change planes. And it was the second bumpiest ride I ever had in my life. First had been about 30 years earlier. And it was I'm a pretty good flyer, but it was pretty harrowing. And I knew in an hour I'm going to be heading out the same way and go through it again. So we got airborne, and the plane started doing this really badly, to the point that finally a flight attendant got on the horn and said, folks, Captain says to me, we've got about 3 more minutes of this, and then it'll smooth out. So if you can just hang on till then. So I said, okay, I'm going to calm myself. I closed my eyes. I started doing slow breathing. And in my mind, I counted slowly to 180. 1 Mississippi, 2 Mississippi, 3 Mississippi, whatever. And sure enough, at right about 180, it smoothed off just as she had promised, and it was just terrific. So, you all are worrying what's going to happen to you between now and January 1st, 2014, when you're supposed to be up and running on all this new healthcare system. Just close your eyes, breathe slowly, and count to 27,734,000, and you'll be right there by January 1st. Now, before we get started actually down this road, I'm going to have to tell you, NFIB doesn't give you business advice. Tell you sort of the diagnosis as we see it, the way we see things fit. You're going to have to talk to professionals. People ask me, what's the most important thing I can do in preparing for this? I tell them, add 3 bedrooms onto your house. 1 for your accountant, One for your attorney, one for your broker, because you're going to be spending a lot of quality time with all three of them. And I am serious about that. You're going to have to ask and ask and ask, because we don't know what the legalities are going to roll out looking like. You're going to have to stay abreast of it. Your business this year is the health insurance business. I don't care what industry you're in, you're now in the health insurance industry. That's the key spin on this. And there are lots and lots of questions out there that you're going to have to be asking all year, and for which there are no answers right now. What will an insurance policy cost come a year from now? You'll see all sorts of forecasts, but quite frankly, this thing is so different, so far out, so distant from anything in our experience, that there really is no way to tell exactly what it's going to cost. One thing you can be assured of, it's going to cost a lot. If the price is going to, the Affordable Care Act is going to make it unaffordable for a lot of people. And by the way, some people who were strong supporters of the law are beginning to realize that and write about it, about the train wreck that's coming on it. You're going to have to ask, what's the impact on your state and federal budget going to be? Because we don't know. You can get an estimate. The Congressional Budget Office, bless their hearts, they do a good job, they try very hard, but they're under very tight restrictions of how they can do their forecast. They don't know what's going to come down. And if you want to look, you can see some of their recent forecasts. The federal authorities from all sorts of agencies had said, well, there are going to be about 4 million businesses eligible for the small business health insurance tax credit. Last count looked like about 170,000 of them actually took the thing up, getting an average of about $2,000 per business. And this was supposed to be something that was going to induce employers to say, by God, I'm going to go and offer insurance and hire some new people because of this generous tax credit that they keep talking about. $2,000 a business for 170,000 businesses across America. You're going to have to, your first big question is going to have to be, are you big or are you small? In Alice in Wonderland, she asked that question too, and the answer got confusing. It's going to be confusing for you too. It's going to depend on how many full-time workers you have. A full-time worker, in this instance, being defined as 130 hours or more a month, although it's defined differently in other parts of the law. Plus, you're going to have to take all your part-time hours and add them up and divide by 120. And each unit there will be an extra full-time equivalent. And by the way, you're going to have to say, if you own 2 or 3 companies, they're probably going to add them together and say, you're the owner, so we're going to count them all as one. So if you've got, yeah, I think I heard some groans. If you think you're going to get out from under this by subdividing your company into some pieces, it's not likely that you will succeed. And in fact, there are provisions within the law that say specifically, if you change the structure of your business to get around this mandate, they're just going to say, nope, doesn't count, we're still going to stick and consider that way. So you're going to have, but again, this will depend on what some guy in a cubicle in Washington says. You know, I think this guy has 3 businesses, no, I think he's 1 business. It's a complex law. You're going to have confusion about those of you who hire seasonal workers. And actually, I'll add that there's a new rollover regulations that just came out. And now, for the first time, there is a distinction made between seasonal employees and seasonal workers. And they both count very differently in this law. And they kind of defined what one of them is. And the other one, they kind of said, we'll get back to you later in the year and tell you what that other one is. So, I don't know what it is, neither do they. But you're going to have to count them, and you will owe, either you're going to have to buy them insurance, or you're going to have to pay penalties for not doing so for if you happen to be 50 or above. The Secretary of State said earlier that 95% of those registering as corporations in the state are under 50. It may be 100% of them by the time this thing gets through rolling through the corporate landscape. Will the exchanges open? Again, we don't know. Will Medicaid expand? That's going to have an impact in different states. Are they going to grow it? What are the impacts if you do? What are the impacts if you don't? I just got an email from a friend who used to run the policy arm of Medicaid, Medicare. He asked me, how is this going to work? And I said, I don't think it's the way you're thinking. And the two of us went back and forth and said, let's just talk later in the week because neither of us knows what the impacts are going to be and we need to figure it out. One of the biggest things you're going to have to deal with is the question, will the doctor see you now? This is a little thought about thing in this law. A friend of mine called up an economist who's just been shifted over into healthcare. He said, I'm now doing some work in healthcare and running the numbers. He said, are you aware, and I'll use economist speak first and then I'll translate for you. He said, are you aware that all the government forecasts assume perfect elasticity of supply of inputs to healthcare? I said, yep. And what that means is it assumes, all the forecasts that are out there assume that if suddenly we want you and I and all of the rest of them who fill that stadium want 25% more health care this year, that somehow there are going to be some brand new doctors and hospitals and nurses that'll just pop up magically out of the ground and fill that. We'll do an occasional pop quiz here. What happens in your business, whatever industry you're in, when demand goes up and supply stays the same?
Prices go up.
Prices go up. You are now exempt from the exam. Perfect. A Berkeley professor who's a famous blogger and sort of famously on the left and a big supporter of this law just posted a comment on his blog a couple weeks ago. He said, quote, and he's asking his readers, what is your guess as to what will happen if Obamacare works for access, works for quality, works for coverage, but the extra healthcare workforce needed isn't there and the lines start to get longer? And honest to God, it was a serious question. I mean, I gather it's the first time it ever occurred to him that that's a problem. There's a paper that was produced out of Duke University, I don't know, maybe 10 years ago, that shed a little bit of light on this. It said, now, the U.S. government has something called the Preventive Task Force. It looks at preventive measures and decides what should each of us be getting. So you should get this many mammograms at this stage in life, and you should get a tetanus vaccine, and you should go get screened for this, and a pap smear, and all of these other different things. And these are things that a person who's prudently taking care of their health ought to do in preventive care. So this study 8 to 10 years ago said, what if everybody in the U.S. listened to this advice? And they did calculations, and they figured this would consume 7.5 hours of the day for every primary care physician in America. Now, how come your doctor can see you when you're sick? Because not everybody's actually coming for all of these recommended procedures, preventive procedures. Well, this law now makes all those procedures free. And anybody who had second thoughts about, no, I don't feel like spending the money to go down and get the doctor to do this, it's now free. So how many people are actually going to come out and how many hours of the doctor's day are now going to be taken up by this free stuff? Nobody knows. We'll see. One of NFIB, we've got 2 big projects going right now. Now, first of all, if you don't know, NFIB led the charge to get one of the single worst provisions out of the law. It was the first time it was amended. This was the infamous 1099 provision. And your business, just as this year you're going to be in the health insurance business, you would have been last year, or in 2011, you would have been in the filling out 1099s business. And very quickly, everyone realized this isn't going to raise any revenue. The president said this has got to go. Harry Reid said it's got to go. Nancy Pelosi said it's got to go. John Boehner said it's got to go. Mitch McConnell said it's got to go. Everybody said it's got to go. It took 6 months of struggling and fighting to get them to take 164 words out of this law to get rid of a small, useless provision that everyone agreed would do no good and would do incredible harm. We got it out. But now there are two other biggies that we're fighting. One is the health insurance tax. Politically, it sounded lovely. We're going to tax this health insurance. So we're going to take a health insurance company and tax them for every policy they sell. Well, the insurance company is going to write the check. Who's actually going to pay the bill? You guys, me. Now, this tax would be about $90 billion between now and 2020. And my best guess is that in the next 10 years, if it's left unchanged, it'll be $200 to $300 billion in taxes. And guess what? It's only on you and me. It's only on the fully insured market. It's only on small businesses. It's only on individuals. Doesn't apply to the big businesses, the self-insureds, whatever. You're going to pay it. And really interestingly, it's the only tax I know of in the U.S. tax code like this. If you are all paying this tax, and all the people in this room, side of the room decide, let's get out of this thing, let's go self-insure. You guys don't have to pay it any longer. You guys have to pick up the tab that they left behind. So if the last person in the fully insured market in America is a small dry cleaner in Atlanta, Georgia, that guy's going to owe $14.3 billion in taxes come 2017. We're trying to get the health insurance tax out, and we can use your help, and I'm sure we can find ways to use you for that if it interests you. Now the other one that we are fighting, and it's the big issue that people ask us about, is the employer mandate. It's this for any company that is 50 and above. And again, 50 and above, and even if you're below that, it might affect you because you might have to turn down a contract. You might have said, you know, my ship's about to come in, I've got a big contract, but you know what, I don't really want to get into this business of this 50 and above thing. Now we've got a quarter here, for the first time in a while, of negative growth. The U.S. economy shrank last quarter. If it does that one more time, we're back in a recession. It's officially big scarlet R written all over Washington's clothing. And I would say that if that happens, this employer mandate could very well be what tips the balance to go over in that direction. Because this is going to be huge cost. The lowest cost there, a company with 50 employees, you end up paying $40,000 in penalties for not providing insurance. We have a member down in Texas who testified before Congress. He's got 450 employees. They tend to be relatively low-wage employees. He's offered insurance. They have refused it over the years. So he buys it for his managers, not for the line guys, because they declined. Well, come January, he will owe close to $1 million in penalties per year if they don't have that insurance. And as he told Congress, I don't make $1 million. So you're going to send 450 people out of work, or I'm going to have to sell this off and break it up into pieces to other people. So now we're beginning to see all sorts of strategies coming out about how do you stay under the radar, under the 50 radar. So first of all, a couple of restaurant chains made big news by saying we're thinking of just cutting our employees back to below 30 hours a week, which would keep them below that level. And they caught all sorts of grief. All sorts of people came out saying these greedy businesses, blah, 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 going after they're not treating them. So I said, all you got to do is sit back and wait a little while. And then a big bombshell fell out of Pennsylvania about 2-3 months ago. Community College of Allegheny County, Pennsylvania announced we're ordering all of our adjunct professors, many or most of whom I suspect supported this law, we're cutting it back to 29 hours a week. For some of them, that's a 1/3 pay cut. And the college said, we can't afford to buy them insurance or to pay this penalty, so we're just cutting back. And so one of the professors was plaintively quoted in the press saying, I've kind of got a double whammy. All of a sudden, I'm being ordered to buy health insurance, which I haven't had before. And secondly, they're cutting my paycheck by a third. And I wrote a little piece saying, actually it's a triple whammy, because that insurance is going to go through the roof as soon as this happens. So they're cutting hours. Now this month, there's a whole bunch more, another flurry of these. So they're cutting, others are. There was Stark State College in Ohio, sent a letter to its adjuncts. In order to avoid penalties under the Affordable Care Act, employees with part-time or adjunct status will not be assigned more than an average of 29 hours per week. So they're committing it to paper. Because of this healthcare law, you lose part of your paycheck. Now, one professor there got quoted. Now, I feel bad about this because I read about him. He seemed like a decent enough fellow, but he was deeply upset, was quoted in the paper, saying, in education, we're working for the public good. We are public employees at a public institution. We should be the first ones to uphold the law, to set the example. And I got bad news for them. First of all, I got one to pick. Yeah, I'm also an adjunct professor and at public institutions. And I like what I do. I'm very proud of what I do. But I'm no more special in that than any of you. He's doing public good, but so is the plumber, so is the software programmer, so is everyone around here. We're all in this together.
Thank you.
So, thank you. So I can't go with him on that. But anyway, he feels good about what he does in life. The thing is, his employer is upholding the law. It's upholding the parts of the law he doesn't like. It's upholding the part that says, I can cut your paycheck by a third and send you off and not buy this stuff because that's the way they wrote it in Washington. So, he says they should set an example. Oh, are they setting an example? And it's an example that is going to be replicated across the country. The Commonwealth of Virginia, where I'm from, just announced 37,000 state employees who are working on an hourly basis are hereby restricted to 29 hours a week, and that includes all the adjunct professors at all the colleges in Virginia. So we're cutting some more hours there. Now, the Wall Street Journal had an article a couple of weeks ago in which a fellow, an entrepreneur, software entrepreneur, wrote, I'll tell you what we need to do. What we need to do is, if you're a company that's over 50, break your company into many small pieces and fling them off. Take your accounting department, sell it to somebody, deal with it as a vendor. Take your HR, deal with them as a vendor. Accounting, deal with them as a vendor. Everybody comes an independent contractor. Is this legal? Because the government's kind of warned that, well, we're going to be kind of watching out for this. Well, I'm sure there's some lawyers just chomping the bit there, waiting to decide whether this thing is legal or not. But there's certainly going to be some that try it. And I'll ask you, from a business perspective, does it make, here's another pop quiz, does it make any sense for you to go shatter your company into a million pieces to do this other than to evade the mandate? Yes or no? Is it good? Is this something you'd want to do? Probably not. But some are going to do it. Here's another strategy some are looking at. Take your employee, valued employee, lay her off, send her to a temp agency, say, I want her back, but as your employee, not mine. Now, the federal authorities have said, we're going to watch out for this, and we're going to make sure that doesn't count. We're going to treat her as your employee anyway. We'll see. We'll see how that works. Does it make sense to fire your trusted employees and bring them back as temps?
No.
Yes or no?
No.
No. Well, it makes sense only in this context. But I'm talking about in the regular world. So,
Apparently this is...
there's a University of Chicago economist who writes for the New York Times. He had a neat little graph that shows in France, where they have similar restrictions, You go down the number of companies with 49 employees, the number of companies with 50 employees. There's 2.4 times as many companies with 49 as there are with 50. Is that some magic that the proper size for a company is 49? No, it's because they're all cutting back just enough to avoid all these laws that France has laid down. Hawaii's been doing this, has had an employer mandate since 1974. And their employer mandate says you got to provide insurance for anyone who works 20 hours. What do you suppose is a really common work week length for employees in Hawaii?
19.9.
19 hours. It's the magic 19 hours. That's the perfect amount of time you need from an employee. So they're kicking their workforce there. Now, in a little bit of kind of pleasant smiles there, the Wall Street Journal had a report about a week and a half ago on labor unions, which have suddenly got the idea, kind of they're doing a Homer Simpson, they're realizing this thing hits them too. And they've suddenly realized, actually I think one of the unions that was quoted was in Atlanta, Georgia. It was a pipe fitters union. It's going to cost them an extra 50 cents to $1 per hour for all of their members. And they're suddenly said, you know, that's going to make it real tough for us to compete with businesses that are under 50. So, you know, and if we're not providing health insurance, why does anyone want to join a union? That was one of the quotes in there. So they're seeking special dispensation. You're not supposed to get a subsidy if you're getting employer-provided insurance, but they're kind of saying, well, could it be a little different for unions? Could we have our cake and eat it too? And so that's something you're going to watch out for. Then there's a new reg that says, now you've got to provide affordable, if you're over 50 or over, you got to provide affordable coverage. But the wording was sloppy. You know, they were crafting this thing all through the night, you know, a few years ago. And they realized it only has to be affordable for the employee. You have to offer coverage to the families, to the dependents, or you'll be penalized. But you don't have to make the dependent coverage affordable. So the quick and easy answer is I'll offer generous coverage to my employee and I'll charge the moon for the kids. Now they realized, and by the way, they realized the way the wording was, it looked like those kids then wouldn't be able to get subsidies. If the employee says, I want the insurance, but my family, I can't afford it for them, that they wouldn't be able to get those government subsidies. Well, they've sort of tweaked the regulations, so yes, they can, but they tweaked them in a way that's not very generous compared to other people who will get those subsidies. So, again, a huge scholarly supporter, a law professor who was a big supporter of this law and a very vocal, a very able and capable one, wrote last week a long piece that he summarized. The bottom line is employers can offer unaffordable family coverage and avoid a penalty. The federal government will pay less for premium tax credits as fewer people will be eligible. Hundreds of thousands, probably millions of children and spouses will remain uninsured. Again, this is someone who was a big supporter of the law. Now, I'll argue that the one industry in America, the one assembly line in America that is really rolling out at full speed is the one that's producing regulations for this law. You know, the shelves in my office are starting to bow like this, and I keep wondering when it's going to snap there. The shelves look great. 3 pages of the employer mandate is now 144 pages of regs. 1,000 pages of law is now 10. I've heard 13,000 pages of regulations. Now, none of this should be a surprise. Washington Post, 2009, months before this passed, great older economist Martin Feldstein, who's a big advisor to Ronald Reagan, wrote, Obamacare could have the unintended consequence of raising health insurance premiums and causing a decline in the number of people with insurance. And just a week and a half ago, the Congressional Budget Office revised their estimates to say, well, in August we thought only 4 million people were going to lose their employer-sponsored coverage because of the law. Now with the new regulations, we think it's 7 million. and I will guarantee you it's going to continue rising. And so this mandate is arguably falling apart. And that is why NFIB says it's time for Congress to act and get this off the books because of the damage that it's doing to the American economy. And in a piece that I've just written that will be out next week, I have summed up all these points that I just made to you about the employer mandate. The whole thing can be summarized as cut some hours, cut some more, cut departments, tax galore. Kick your workforce, kick yourself, kick the children, break the shelf. Mandate crashing, time for trashing. So with that, folks, why don't we go to some Q&A, and I've talked to you about what I wanted to talk, let's hear what you want to talk about. And there is a mic there. Yeah, if you got a question, why don't you head over to the mic so everyone can hear?
I'm curious, I'm guessing that probably a greater percentage of small businesses have less than 50 employees. A lot of people here today, my firm would be one of those. We're 10 people out of Woodstock, Georgia. And we've already seen dramatic increases. This year, our first shot at last year, our first premium increase that came was 50%, literally 50. Our old premium multiplied by 0.50 was our new premium. So we wholly expect that to happen again this year, at which point I pay 100% coverage for my employees that take it, that don't have coverage to another spouse or some other way. I'm not going to be able to do that again. That was the limit last year. And so if they try for the small firms, I envision where, okay, I'm just not going to be able to provide health care anymore. How does an individual person now get Obamacare? Where does that person go to get their free Obamacare? Or what happens to my employees when I say, that was it, I can't buy it anymore, I'm sorry? What do we do?
Well, it's a problem, and again, don't take any of this as advice, or NFIB says you should do this, or anyone else should do this. But I suspect a lot of people, a lot of employers are going to say, you know what, I can't afford it. I'm going to pay the $2,000. And if you're big, you'll pay the $2,000. If you're small, you say I don't have to pay anything. Go to the exchange and get it. And a lot of them are either going to go to the federal government, to the exchanges, and get subsidies. If you have low-income employees, relatively low wage, the federal government's going to pay for almost all of their insurance. I think the Congressional Budget Office has grossly underestimated how much that's going to cost the federal budget. So I imagine we're going to see a spike in the deficit as a result of this. How are we going to pay for that? We're not in the greatest fiscal shape to begin with. This is going to worsen it. Another thing, though, is that they built into this something called guaranteed issue, which is that no insurer can refuse you at any time. So, one strategy that people will do, people in Massachusetts have been doing it for a few years now, and actually guaranteed issue has been in a couple of other states for some years, New York State, Vermont, I think New Jersey. What people do is they just go without insurance till they get sick, then they go and buy it, and then they get treated, and then they drop the insurance. Now what that means is that increasingly people who have insurance are people who are really sick, which means the premiums go through the roof. So I expect you'll see, they call that jump and dump strategy. Jump in when you're sick, dump it the moment you're well again. So I expect you'll see a lot of that because the individual mandate taxes are not very high. And the Supreme Court, before the Supreme Court ruled, it was a penalty. What the law essentially said was, if you don't buy insurance as a person, you're a bad lawbreaker and we're going to fine you for it. The Supreme Court said you can keep the law, but it's no longer a penalty, it's a tax. It's a choice. You can get some insurance, or you can pay a tax. You pick, it's not a problem. You're not doing anything wrong either way. That's essentially what the Supreme Court ruling says. So will that change people's attitudes? My guess is it will. How much? We won't know till it happens. So the answer is, I think you're going to see a lot of that, and we don't know what the effects are going to be. Yes, sir?
Thank you. I have a multi-part question. Thank you, number one, thank you for being here.
Thank you.
I've heard a lot of great things so far from you. One of the things that I didn't hear you talk about was what kind of policy will be mandated by the federal government? And what will be the cost of that policy?
Absolutely. There are a whole lot of things. First of all, no more limits, no more annual limits, no more lifetime limits. And here's another special thing just for you small business folks. If you're under 100 and fully insured market, you are subject to what's called the Essential Health Benefits package, which means the Secretary of Health and Human Services can determine a checklist at will. I think from now on, every insurance policy has to cover this, and this. And wakes up one Thursday morning and over Cheerios says, you know what, I think this belongs on there too. And that means your policies are going to have to cover these things, but if you're working for a big business, a labor union, government, no, it doesn't apply to them, it's only to you. So now, in fact, they've complicated it because they realized this was kind of a messy situation. If they made it really generous, the prices would go like this and they'd get a lot of flack. If they said, well, okay, we're not going to cover this, and this, then they'd get a lot of interest groups clamoring for additions. So they said, you know what, we don't really feel like doing this. We're going to kick it to the states and let all 50 states decide the package on their own. So they handed it back down to Georgia and said, you figure out what the package is. But they kind of left oh, but by the way, if we want this back next year, we can take it back. So everyone is up in the air about what is going to be required. But yes, absolutely, you're absolutely right.
Second question. Those of us who are small business owners, but also over 65, what is going to happen to Medicare as a result of this package? Will it get better or will it get worse? Can you give us an idea?
Sure. Okay. The immediate is they did yank $700 billion out of Medicare. And they say, well, we're just going to pay the doctors less and they'll still do the same work. I actually haven't met that doctor. If I were a doctor, I wouldn't be that doctor. So the usual thing has been for many years, there's been something called the sustainable growth rate, which says you got to limit the amount that we reimburse doctors, except every year they say, next year we'll do it. Now, next year. They've been doing that every year, and they're doing it again now. So first of all, are they actually going to they're either going to cut your doctor's pay by a substantial amount, I think it's like a third. Actually, I think it was 27% cut, immediate cut, and expect your doctor to do the same work for 27% less. Or they'll keep doing that every year and borrowing the money to do it. And Medicare runs out of money in not too many years, and certainly most people in this room, or at least a lot, are young enough that you will live to see that at the current scheme with Medicare, the annual payments are going to cost more than the entire U.S. tax system brings in, which means no room left for anything other than Medicare. Now, there are all sorts of, then you get into the finer details. The solution that's offered in this law to make healthcare more efficient is called accountable care organizations. Now, this is supposed to be kind of, you get a bunch of different practitioners and different specialties together, and they really manage your case and look at you sort of holistically, all the doctors working together and all the providers. My doctor said to me one day when I was at her office getting a checkup, she said, can you explain to me what an accountable care organization is? I said, sure. I said, you remember HMOs? She said, sure, of course. I said, well, now the H is an A and the M is a C. That's about it. It's, except that also it allows them to get around antitrust regulations a bit. So the Congressional Budget Office predicts 1/6 of hospitals are going to close because you're going to see consolidations toward urban centers. So rural care is going to get worse than ever. If they actually saw through the cuts in Medicare reimbursement that are in this law, senior citizens, a doctor would get less by seeing a senior citizen than the doctor would get by seeing a Medicaid recipient. And my guess is you're going to end up with a lot of people going to public health clinics because there isn't going to be anywhere else to go. So, will ACOs work? Well, I tell my friends I hope they will. It'll be a nice thing. And unfortunately, I tend to view them as we've kind of been there before. HMOs had their virtues and they had their shortcomings. It didn't really change the direction the costs were taking. And I've got a friend who, well-known health economist, written a book that I'm teaching out of this semester, and he said he will make the argument, and I'm sort of agnostic on it because he knows these data better than I do. He said if you look at the history of innovation in healthcare, virtually none of it comes from the demand side. It all comes from the supply side. That it's not that payers like Medicare or Medicaid or insurance companies go to innovators and say, we want you to develop a new product that gets things better. It's that someone like you comes up with an idea that no one wants or has even heard of, and you push it, push it, push it till it happens. And I was telling my class at George Washington University this week, so you think of any innovative industry you know of. So, did Steve Jobs build the first Apple because a bunch of banks came to him and said, we want you to develop something for our accounting systems? No, he struggled in a garage, built something that not only did no one want an Apple, they'd never heard of it or thought of it. And he pushed it, and I told them, do you remember, they're too young to know, but do you know how the Apple first got to be a big thing? Do you remember their marketing strategy? They gave them away. They went to school systems and said, we're going to give you enough for every kid. And the school system says, fine, we'll take it. And then after they saw it, we'll have to figure out something useful to do with it now that we got it. And then the school system next door said, how come we can't have that? And he said, well, you can, you just have to pay for it. And Apple became the giant that we know. But it didn't start because someone in the government said, we want you to develop little teeny tiny computers. It's because some entrepreneur figured out a product and pushed it out. So there's nothing in this law that does that. In fact, I think it stifles it. It makes it less likely that someone like you folks will actually develop something useful and go to it. We shall see.
One last brief.
Okay.
Most small businesses are paying their business taxes as an individual.
Yep.
Tell us briefly how the additional $700 billion in taxes on individuals will affect us.
All right, let me put in a little plug for a product that I produce with the help of my colleagues at NFIB. If you go to nfib.com/cribsheets, nfib.com/cribsheets, we've got, at the moment it's 17, I think it's 19 so far, things that tell you about the small business tax credit, about the employer mandate, the individual mandate. I produced one that it's, how is this law going to affect your employees? Because it's going to affect them, and it's going to affect them big, and they're going to think it's your fault. So I produced this so that you could take this 2-pager, give it to your employees and say, read it and let's chat about it. Because these are the things, and I'll throw out one example in it. So take the employee who's earning $41,000, and he and his wife have 3 children, and he comes and says, boss, guess what? She just had a 4th, we're very happy. And boss says, great, so am I, because you're no longer eligible for my health insurance, you're on Medicaid now, because of the formula. Because at that point, the trigger trips, and he's no longer capable, no longer allowed to buy private insurance. He's got to go to Medicaid because his wife had a child. I produced one on the Medicare taxes. These are complex, they are deadly for a pass-through business. They add a 3% 3.8% tax on investment income over a certain threshold, and a 0.9% tax on wage income over a certain threshold. Now, this has been misinterpreted as a sales tax on home sales. It's not. It takes a very special circumstance for it to even touch a home sale, and it's not huge in that. But nevertheless, for many things, this is a big addition. Essentially, it is adding a big chunk to the cost of capital now. And one of the, there's a series of questions. I have no idea what happens now when an angel investor comes in and wants to put some money in your business, how it's going to wrap them up in this. Same with the employer mandate, by the way. If the angel investor becomes a part owner and they've already got another company, are they suddenly counted as one company, and by investing in yours, they've gone over the 50 threshold? There are all these questions that some have been answered, some have not. But these Medicare taxes, and it's kind of great because they're called Medicare taxes, but they don't actually go to Medicare. They'll be used to fund Obamacare, not Medicare, but they call them Medicare taxes. So these will be big taxes, and if you go to the crib sheet in 2 pages, you'll know everything you need to know about it. Not really, but you'll know. You'll be able to give a lecture on it in 5 minutes of reading, but it's a lot easier to get it that way.
The question I have is, you mentioned something earlier about seasonal employees, and my understanding from watching the webinar that you all put on earlier this year was that they would not be eligible for coverage. And I want to add the second part of that question. Assuming you're over 50 employees here, which we are.
No, they're required to get coverage. So
they are required to get coverage.
Yeah.
Okay.
Let me interrupt, if I may.
Sure.
I'll make it. The employer mandate's a 2-step process. The first one is a question: are you 50 and above? And the second one is, how much do you, if you're 50 and above, how much do you owe? And they're calculated completely differently. So for instance, part-time hours are counted toward the question, are you 50 and above? You got a bunch, if you employ, let's say, you employ 100 people at 20 hours a week, or slightly different, let us say 15 hours a week. You are thereby calculated as 50 full-time equivalents, and the law says you're 50, so you are into this. Now it looks and says, the question, how much do you owe? Well, they're all part-timers, so you don't owe anything. If you had 50 full-timers, you'd owe $40,000. If you have 50 full-time equivalent part-timers, you owe nothing. Now, that said, a part-timer counts in the first question. So part-timers can put you over the 50 threshold, but then you don't owe them insurance or penalty. Seasonals cannot put you over the threshold. They don't count in this question, but once you hit 50, you owe them insurance and or penalty. So once you have hit 50, you're gonna have to buy insurance for that seasonal who comes and works you for a month. Now, there are all sorts of look-back provisions to try to smooth it out. I frankly don't understand the calculations. You can look back at 6-month periods over the previous year, and decide, do these count or not? But again, this is where you better go to an accountant, and probably a really good one. Okay, now, go ahead and finish.
Okay, as far as the part-time employees, those are not eligible. If you offer insurance, you said something earlier about the man in Texas. If I offer insurance to all of my employees and they decline it, then they're responsible for the penalty, not me, correct?
Yes, there is what is called a firewall, and if you offer it, they cannot go to the exchange and get a subsidy. They can go to the exchange, but they're going to pay full freight. But there is a firewall that says as long as you are offering qualified coverage that is affordable, that's a 2-part test, then they can't leave you and go to the exchange, and you don't know anything on them. On the other hand, it has to be affordable, which is defined as the employee portion of the premium cannot exceed 9.5% of their household income. And the question was raised, how do I know what their household income is? And so they created They call it a safe harbor. You can just look at 9.5% of their W-2 income, but that effectively means really you have to be paying a lot more to be sure of it than you would if you actually knew their household income. Because you might be offering coverage that really only costs them 5% of their household income. But if you say, well, you can just look at their W-2, it's 10% of his W-2 income, so I'm not safe. I gotta be more generous there. So there you go. I don't think of it as much of a safe harbor. Some people do. Do we have one more?
Just a quick follow-up.
We'll follow up with him after.
Okay.
We're short on time.
Sure.
Thanks, folks. I hope I have brought a little sunshine into your day.